Social media misinformation can negatively influence people's attitudes about vaccine safety and effectiveness, but credible organizations, such as research universities and health institutions, can play a pivotal role in debunking myths with simple tags that link to factual information. Univer. Researchers found that fact-check tags located immediately below or near a post can generate more positive attitudes toward vaccines than misinformation alone, and perceived source expertise makes a difference. In fact, fact-checking labels from health institutions and research universities were seen as more expert than others, indirectly resulting in more positive attitudes toward vaccines, said Jingwen Zhang, assistant professor of communication and lead author of the study. The findings were published online Wednesday, January 6, in the journal Preventive Medicine. Has implications for COVID-19. The data was collected in 2018, before the COVID-19 pandemic, but the study's results could influence public communications about COVID-19 vaccines, researchers said. The most important thing I learned from this paper is that fact-checking is effective. Giving people a simple label can change their attitude, Zhang said. Secondly, I am calling for more researchers and scientists to engage in public health and science communications. We need to be more proactive. We are not using our power right now. While there is a strong consensus in the medical community that vaccines are safe, cost-effective and successful in preventing diseases, widespread vaccine hesitancy has resurged in many countries, the study said. The United States has faced issues with lower than preferred vaccine participation for influenza and even measles, which medical experts blamed for a 2019 measles outbreak. Because both individuals and groups can post misinformation, such as false claims about vaccines, social media have played a role in spreading misinformation, Zhang said. Study authors tested the effects of simple fact-checking labels with 198 people nationwide who showed different levels of vaccine hesitancy. In the experiment, researchers used multiple misinformation messages covering 5 vaccine types and 5 categories of 13 different fact-checking sources. They avoided any explanations that repeated the false information. Using a mock Twitter account, one post, for example, consisted of a misinformation claim on a specific vaccine and a picture of a vaccine bottle. It read, according to a U.S. Vaccine Adverse Events Reporting System (VAERS), there were 93,000 adverse reactions to last year's flu shot, including 1,080 deaths, 888 hospitalizations. Researchers then used alternating fact-checking labels from various sources in media, health organizations such. One read, for example, this post is falsified. Fact-checked by the Centers for Disease Control. Learn why this is falsified. The results showed that those exposed to fact-checking labels were more likely to develop more positive attitudes toward vaccines than misinformation alone. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you technological news. Thank you.